My name is Gary Price. I'm board certified in internal medicine and gastroenterology. I practice in Fort Myers, Florida. I'm actually one of the original pioneers in concierge medicine. I started 19 years ago. At the time, I was unhappy with the way insurance companies had pretty much corporatized medicine and decided to try a different approach altogether. So I started out by getting rid of the insurance companies. I opted out of Medicare and all insurance companies. I reduced my patient panel from several thousand to 350 and converted it into the type of practice where people can call me whenever they want. My patients pay an annual fee, so there's no paying every time they come to the office. And for that, they get my cell phone, my email, any access 24/7. When they have a question, they can call me, they can email me, text me, whatever, any means of communication, and they'll get an answer usually immediately. If they need to be seen, I'll see them the same day. If they need specialists, I'll arrange that for them. If they need specialists that are very unique, that only exist in a few medical centers, I will arrange to refer them to whatever city they're in. So they really get very comprehensive, good, mostly preventive health care, but when they're ill, we take very good care of their illnesses. So I would say my practice is, if you wanted me to describe it in a capsule, I'd say it's a very attentive practice where we provide the best health care possible with very good service. That means punctual, polite, and professional service. The fees are the same for everybody. There are no different fees, there are no family rates, it's the same fee for everybody. In my practice, there's a cap on the number of patients that each doctor will take, and that cap is 350, which I've found through experience over the years is the optimal number for a doctor to have enough volume to stay really sharp, but still keep it small enough that every patient can be attended to immediately. We use hospitalists and we take care of our own patients in the hospital. So, for example, if a patient needs to be admitted, I will usually contact the hospitalist, let them know what we're seeking. They will do the actual admitting, and I will go see the patient on a daily basis and follow their care, make additional suggestions, and guide their care as needed. So they really get the best of both worlds. They get the efficiency of a hospitalist and the personal care of their private physician. My practice is mostly an office-based practice because I have equipment in the office that helps me in my work. But when people are unable to come to the office or for whatever reason need a house call, I'll be very happy to make a house call. I enjoy it very much. It's an opportunity to see how my patients live and their surroundings and so on, which gives me another angle to see them through, which is very beneficial for both. My practice has a wide variety of aged patients. For example, I'd say half or so are Medicare age, which means 65 or older. The other half are younger and spread out across the continuum. I'd say a lot of the youngest patients would be 15 maybe. I don't do pediatrics, and even though my patients often want me to take their children, I don't do that. I take them when they're about 14, 15, because by then they're really little adults, physiologically that is, yeah. After hours, my patients can call my cell phone. That's the primary means to access me. There are occasional areas where I live where the signal is not particularly good. So I also have an answering service really for backup. In case I can't be reached, they can call my answering service, which can page me. And that's how they reach me. It's very easy. When I go on vacation, I have 2 partners, and they cover my patients when I'm away as I cover theirs when they're away. So we always have at least 2 doctors available.